Hi, I'm Dr. Edward Wingfield. I'm an interventional cardiologist with Hamilton Cardiology. During the month of September, which is Peripheral Arterial Disease Awareness Month, or PAD month, the objective is to increase awareness and increase education on PAD because it affects so many. 1 in 5 patients over the age of 50 have peripheral arterial disease. We're looking at 7 million people in the United States with PAD. So, who is at risk for peripheral arterial disease? Patients who smoke, patients with a history of diabetes, high cholesterol, and also high blood pressure. So, symptoms of peripheral arterial disease. There is a gamut. 50% of patients with peripheral arterial disease are asymptomatic, meaning no symptoms at all. A third of patients with PAD tend to have claudication. Claudication is pain with ambulation or walking, pain when walking, that improves with rest. You walk a block, a half a block, 2 blocks, you start to get leg tightness, cramps in the calves, cramps in the buttock, you sit and rest, the pain goes away. That is called claudication. This can also progress to rest pain, where there's pain without ambulation, and finally skin breakdown, gangrene, infection, and amputation. So how is PAD detected? Typically, our first line of testing is an ABI. An ankle brachial index is a non-invasive test that compares the blood pressure in the upper extremity to the blood pressure in the lower extremities. Any difference or offset between those two numbers would lead to additional testing, which would be an ultrasound. An ultrasound is a test that gives us more of a pinpoint measurement of the blockage as well as the location of the blockage. Depending on the result of the ultrasound, there's CAT scan testing and also an angiogram, which is a non-invasive test where we inject dye into the artery to detect the level of the blockages. So, treatments for peripheral arterial disease. Typically, our first line treatment is the patient. We encourage the patient to ambulate. Walking is very beneficial to increasing the circulation to the lower extremities, especially when there's blockages. So if a patient can walk a half a block before getting pain and discomfort, we encourage that patient to try and walk a block. Walking through the discomfort enhances the circulation and improves overall circulation. Number 2, we encourage patients to quit smoking. So smoking is number 1, 2, and 3 in terms of the risk. So smoking cessation is extremely important. Beyond quitting smoking, there's medication therapy. We always start patients on aspirin and or Plavix when there is a diagnosis of peripheral arterial disease. Beyond aspirin and Plavix, we get very aggressive with cholesterol control. So typically a patient is placed on statin therapy, Lipitor, Zocor, Crestor, one of those medications. And in addition, aggressive blood pressure control as well as diabetes control are extremely important in management of PAD. Patients diagnosed with PAD are at increased risk of heart disease and stroke. There's a very strong correlation between blockages and plaque buildup in one vascular bed, that being in the lower extremities, and also plaque buildup in the heart or the carotid arteries or the brain. So therefore, heart disease and stroke risk is increased once we have a diagnosis of PAD. September is PAD Awareness Month, and during the month of September, the goal is to increase patient education and awareness regarding peripheral arterial disease. During the month of September, patients may see doctors in white socks. Currently, there's a white sock campaign where the white socks symbolize the many diabetic patients who present late with late-stage PAD. This late-stage PAD often results in amputation due to delayed treatment of peripheral arterial disease.